So when you got to the camps and saw the situation on ground, what's the plan that the Senate, your committee, for instance, is putting together to ensure that this kind of situation does not happen?
Well, I mean, even before going to the camp, I mean, after reviewing the budget, because of the speed with which that budget came and, I mean, we realized we made a mistake by not putting a lot of attention concerning, allocation to nutrition in the country. So, I mean, we know that this 2017 budget, nutrition must take the proper place. So it's just a matter of allocation, and also to ensure that the distribution, which we are now seeing is also faulty, must be addressed.
Which is what some people also fault, because they say that oftentimes when we have problems, what we tend to do is throw money at the problems rather than try to see, what exactly has brought about this problem. A lot of people are farmers in rural communities. Have we been able to identify, for instance, where exactly this malnutrition is most acute? Is it, in conflict-prone areas? Are we looking at rural communities? Are we looking at maybe areas in the city that don't get as much medical attention as they should get? People who cannot farm their own food and, cannot afford proper food in the market. There are a lot of questions as to why it is that Nigeria will have cases, or acute cases, we're talking about 1,200 children, of malnutrition. Do you think that we ought to be there at all?
Well, I will generalize the answer, because it has to do with the concentration of skilled attention that we don't have in the rural areas. Most of our doctors, our senior nurses, and I mean people that can disseminate information, they rather stay in the city instead of going to the rural areas to try to administer good health. Information is key. Our rural women, they need to have access to information. We have about 150 subscribers to our mobile phones today in Nigeria. Even in the rural areas,
150
million, sorry, 150 million. Okay, so if it's through the mobile phones that we keep on sending all these text messages, instead of all these junk messages we get on the phones, to our rural population in Yoruba, in Hausa, in all the languages, just telling them importance of breastfeeding, telling them the kind of food you should eat every day, because really it's a matter of lack of knowledge. They have with them all the vegetables, they have different things that we use in the city to get good, balanced diet. But if they don't know the importance of them taking such food, there's nothing that you can do.
But aside that, we haven't, as a country, carried out any research to find out really why it is that we should be on that table of acute malnutrition.
Yeah, it's the same human problems, because it's a matter of, we know the right things to do, but are we doing it? I mean, nutrition is the simplest of any medical information that one can give out to any patient. So it's a matter of we have very educated health workers in the Ministry of Health.
Have you spoken to the Minister of Health on this problem?
Well, of course. If we are going to discuss the budget, of course, he's the first person we talk to. But I now realize that we need to do more than that. We need to actually talk to heads of departments as a parliament, because the minister cannot do everything.
What is his thinking in this regard?
Well, of course, I mean, he's overwhelmed with the problem. And I mean, I met the head of the nutrition for the first time last week, which is a misnomer. I mean, I was telling him that, look, you are the head of nutrition in this ministry. You never approached us in the parliament to tell us this problem. We got information about the problem from outside the country. So it's a misnomer. So we need to have more communication with the different parastatals, and also we should not rely only on the minister alone, because if we expect that the minister will tell us everything from polio to anemia to everything, we will not progress.
So now that we have this situation of lack of maybe breaking communication between the ministry and your committee, what do we do going forward so that we can have proper information, and what's the plan to ensure that this situation is somewhat managed so that we don't lose 50,000 children? You've talked about 1,200 every day. So what do we do now?
first of all, for next year, the development partners like UNICEF and so on, they are pledging to treat about 600,000 children next year in their budget. So we should at least do that minimum to 600,000. That is to cater for 1.2 million children in terms of acutely malnourished children.
The question is how? I mean, in the case of the Northeast, in some instances, we know that a lot of the people, a lot of the children are in camps, and so they're easy to reach. But when they're, scattered all over the rest of the country, how do we intend to ensure that children under 5 are able to get the nutrition that they need?
Well, the simplest thing that we can do is to ensure that each federal medical center, for example, the proposed primary health centers, about 10,000 that is supposed to be introduced over the next 2 years, they must all have nutrition departments. So that the primary health centers are supposed to be in each ward. That is the nearest you can get to the people. We have about 9,700 wards in Nigeria. So if we can have functional primary health centers, that in each center we have the products that can treat acute malnutrition, of course, I believe we will notice the difference very quickly because they have access to it.
Are the states in on the plan? Do you intend to do this without the state governments?
Well, they've been talking about maybe the state government should be part of this, but I'm saying the states, they have declared, at least majority of them, that they cannot even pay the salaries of their staff. So if we want to ask for something that won't happen, we should involve the states in the funding aspect. But I don't think that is what we need at this time. It's an emergency. The federal government should take over the funding for primary health care services for this emergency period. I believe when they are even saying Mr. President should have economic powers, emergency, something like that, if this will be what it will translate to, so be it. Because this is an emergency. We need to ensure we have functional primary health centers that will at least be available for people that are malnourished.
Okay, but the Minister of Health was quoted as saying some monies were being budgeted for the primary health care centers. Have those monies begun to go out?
Well, first of all, we haven't received any budget indicating that the primary health centers are supposed to be in place. So I believe we are expecting that. But I believe there was a World Bank donation that has been distributed to the states for them to at least begin to uplift the primary health centers. So that's all I know about.